Welcome, everyone. This is Tony Mazzaferro again with the Store Foundation, and today I'm really lucky to have a guest with us, Dr. Raj. He is a reproductive endocrinologist and infertility doctor in Texas. He works at a place called IVF MD in northern Texas, and I had the privilege of working with him a few months ago for a couple weeks and learning from him and working in the clinic and seeing the procedures and learning more about the specialty in IVF and IUI. So, Dr. Raj, thanks so much for being willing to sit down and chat with me for a few minutes.
Thank you for having me, Tony.
Yeah. So I had a great time with you, and I think it's a really interesting field. And obviously, to those who would be interested in the Stork Foundation, would probably have some interest in what you do. So you basically help make babies. I mean, what what drew you to the field? Oh, kind of a background. Dr. Raj also went to the OBGYN residency, so he could have chosen quite a few different specialties, but you chose reproductive and infertility. What made you choose that route?
I know OBGYN is very exciting, and I think of the different subspecialties in OBGYN, REI is one of the very promising areas, and it's growing, every day. And there are newer developments, very new, exciting developments that's happening in this area, which again, I always had interest in the endocrinology aspect of women's reproduction, and also the fertility side of things. And the more and more I trained, as an OBGYN, I got, really drawn to this area. And I felt like it was very exciting. We can help a lot of people. It's, I just fell for it,
So, simple as that.
Yes. Yeah.
What's I mean, the job, there's a lot of different aspects to the job, from surgeries to procedures to clinic. What's your favorite part about doing what you do?
I think, I think it's, again, engaging with patients and kind of sharing their journey. It's like, that's kind of like the part, the main thing that I do. It's just I spend so much time in the office, but at the same time, there will be things that they need help with. They might need a minor surgery or a procedure to see what's going on. A lot of ultrasound. That is kind of part of how we make decisions. So, I think I like it all, and again, the surgery part is, it is important, but it's not a big part of what we do. We do a lot of office-based procedures and surgery as needed to optimize their fertility. And we do that as needed, and then just, get them where they need to be. Sometimes they might just need a very minimal intervention, and sometimes they might need a more invasive treatment, like or advanced treatment like IVF or in vitro fertilization. But not everyone needs that. Yeah.
Yeah, I think what I really liked about it was the variety. Like, you really are, like, you do lots of office procedures, sometimes surgeries, a lot of clinic. And not just the variety of the practice, but I think just the variety of, like, patients too, which I think people typically think, IVF, it's really mainly just to affluent kind of certain populations, kind of stereotype. But when I was there was patients from, there's immigrant patients, there was every color, every sexual orientation, every background, and that's something that surprised me a little bit, because you kind of think just rich, but that's not really the case.
Right. And they all have different needs too. So we just kind of cater to what their needs are. And, like I said, sometimes it might be just as simple as just helping them, regulate their hormones, or help them ovulate, or sometimes it maybe need something more. They might need a minor surgical procedure, or maybe all the way into IVF, as needed. Yeah, sure.
Yeah. And I think that's something people don't always realize too, is that it's not just IVF what you do. There's a lot of steps before that. There's a lot of medications, other procedures before you do IVF. Although that is obviously
IVF
a big part of what you do.
Just a part. Yeah, just a part of it. Yes, you're right.
Big part of the evaluation. So I really enjoy when I was working with you and seeing, like, that initial workup. Someone would come in saying, I haven't been able to get pregnant for X amount of months or years, and then seeing you work that up. So just kind of just to give someone an idea, say there's someone that's listening that says, "Hey, I'm going to have my first appointment with my REI doctor. I haven't been able to get pregnant for, a year or so.
Right.
What should they expect on that first visit?"
Right. It's just basically getting to know the person, and see what all they've done so far, or, just kind of like to see how things have been going for them since they've started their period, basically,
Yeah.
just kind of get a sense of how regular it is, and, getting to know that how long they've been trying, and, there are some specific things that we would look into, like hormonally, like, their thyroid, and, there's other things that we kind of include in the
Hmm.
history, just to get a sense of how things are working in general,
Okay.
so that is like the history part. And then we'll do like a basic exam just to check everything, and if they are at the office, we might even be able to do an ultrasound just to look at their uterus and their ovaries. We can do that. But now we are doing a lot more virtual consultations with COVID. Usually the ultrasound is not part of that first visit. It's
Hmm.
basically just getting a sense of how things are, and then kind of outline the management for them. It starts off with some basic hormonal evaluation, and depending on their age and their needs, we might do something like their egg reserve test. There are some tests that we can do to know what's their ovarian or the egg reserve is.
Okay.
There are tests that we do to check their tubes. We call it hysterosalpingogram or a dye test, which can check their uterus and the uterine cavity and their tubes. We can do that, and also the partner evaluation. If they have a male partner, we would offer semen analysis. So with these basic hormone tests and the HSG and the semen analysis, we'll kind of get an idea where things are, and based on that, we can tailor whatever treatment is needed for them.
Great.
Yeah.
Great. Yeah.
So that's kind of like what we do at the first visit.
Great. That makes sense. Thank you. It's
Mhm.
if say you're successful and a patient is able to conceive and get pregnant.
Yeah.
I know a common question I have is like, well, how long does the patient stay with you? Do you just stay and deliver the baby? When do they get passed off to their OBGYN? Like, how does that work?
Right. I would love to deliver them. Again, I've done that before, been doing it
Of
for a
course.
while, and then I switched,
Hmm.
fields to do more fertility side of things. But yeah, so we will, make sure they are doing okay before they move on to their OB doctor. That might take up to like 8 weeks or so. We might do an ultrasound or two just to make sure the pregnancy is in the right location. We see a heartbeat, and looks like things are moving along pretty well. Then they can move on to their OB doctor around 8 to 9 weeks is what we typically do at our practice. Again, and that can vary sometimes from different practices. Yeah.
Okay.
Mhm.
Well, makes sense. Well, I
And
appreciate you
of
taking
course,
taking a few minutes. I know you got a busy practice and a busy day, but I appreciate you sitting down and just chatting for a few minutes and letting the folks kind of get learn a little more about what you do and why you do it and
of
how it
course.
works. So thank you.
All right. Thanks for having me. Thank you, Tony. Bye.